Hi there, my name is Louise Warden. I'm one of the hygienists at the Scottish Centre for Excellence in Dentistry in Glasgow, which is part of the Portman Group. We hope everybody's staying safe and well. We know that a lot of people have got a lot of questions about not being able to come into practice where they normally would to come in and see the hygienist and dentist, and maybe a wee bit worried about looking after their teeth and gums. So this is just a few top tips to help everybody at this time till we see you again. So what we're advising to do is just to keep your mouth healthy and clean is to continue with your normal routine that you normally do every day. So that would be toothbrushing morning and night for 2 minutes. Use the same toothbrush you normally do, the same toothpaste rather than changing anything. Same with interdental cleaning, using your floss, your TPs, your water flosser, super floss, whatever you are usually in the habit of doing and have been advised to use by us, is just to continue doing. Now, many people would normally interdental clean maybe once a day, which is perfectly acceptable. With having a bit more time, you might want to up that to twice a day interdental cleaning just to keep your gums and your teeth a wee bit healthier. You might be tempted to order gadgets online that you see or things on Facebook or Instagram for keeping your mouth clean. We would advise you not to do that because we don't know what those things are like. You've never used them before and you might struggle to do that, and they might not be helpful or beneficial. So better just to stick to what you know. The main message is not to change anything and just to try and stay calm and keep your mouth clean and healthy as possible. Now, people might be slightly concerned if their gums start to bleed. And what we're advising again is just to be really thorough with your cleaning. If you do get any signs of bleeding, that's just a bit of inflammation in your gum. So the best thing to do is just give that area a wee bit extra attention. So after brushing for the 2 minutes, you could go back to that area and just give the area that's bleeding an extra clean. Go in a wee bit more with your TPs in that area, a bit more with your floss, and the gum will bleed when you do that, but that's nothing to worry about. Just continue to clean it and you should find after a few days that the bleeding should stop. The same with implants, just continue to look after your implants like normal teeth and how you've been instructed, just keeping them clean and healthy. Now, some people might be tempted to use like a cortisol mouthwash if their gum's bleeding. If that's not something that your dentist or hygienist has advised you to use regularly, we would advise you not to do that because that could stain your teeth and your teeth will become a bit dirtier and you may be wanting a professional clean sooner. So the best thing to do at home would be to make a warm salty mouth rinse, which is just some warm water with a small amount of salt, and you can gargle that around your mouth a couple of times a day. Now, there is airflow powder. We use an airflow system at SCED, which many of you will have had your teeth cleaned with this. It makes them feel really clean. It's antibacterial, it takes off all the stains. Now, you may be tempted to try and find out if you could order the airflow powder, maybe to use in a water flosser for the time until we see you again. But unfortunately, that powder is just only used and sold to dental practices to be used in specific equipment. So again, don't be tempted to try and maybe order anything like this online, because the general feeling is that it won't actually do anything if it's not used with the right equipment, and you don't want to damage or harm anything within your mouth. So the main message is that we just want everybody just to stay calm as much as possible. We know that stress can aggravate things in your mouth slightly, and we know it is a stressful period of time, but just to stay as calm as possible. Just keep your routine going the same way that you've been instructed to do. Drink lots of water, keep a healthy diet, and just try to relax as much as possible. Everybody at SCED is really missing all our patients, and we know that we will see you again soon. And until that point, just stay safe, and we'll see you as soon as we're back open. Thank you. Bye.